Hello, and welcome to Chagpar MD. I'm Dr. Anise Chagpar. Well, September is Ovarian Cancer Month, and I thought we couldn't let September go by without talking about this cancer that whispers. Ovarian cancer is a silent cancer because oftentimes the symptoms are ones that you really would take for granted. A little bit of bloating, maybe a little bit of change in your bladder or bowel function, a little bit of abdominal pain, and yet it can be one of the most deadly. Still, there is a lot of hope and promise on the horizon for ovarian cancer, and so I thought it would be great to hear from one of my good friends, Elena Ratner, who is an associate professor in OBGYN here at Yale, whose focus is really on ovarian cancer. Now, we've got a radio show, as you all know, called Yale Cancer Answers, and she'll be on that show as well. But let's dig in and find out a little bit more about ovarian cancer. What do you say? Let's get started.
Thank you for having me. I am so glad that we're able to have this conversation today and to discuss this very important issue of ovarian cancer detection, especially during this month of September, which is Ovarian Cancer Awareness Month. So ovarian cancer continues to be very deadly. 25,000 women are diagnosed every year, but as many as 16,000 women die. The trouble with this cancer continues to be that women diagnosed so late that most cancers actually present in stage 3 and 4. And even though original treatment is successful, unfortunately, these cancers recur later in life. So every woman has approximately 1.5% chance of developing this cancer. So again, overall, it is not a very common cancer, but sadly continues to be very deadly. Some women, of course, are at higher risk for this cancer than others. As in any cancer, it is very important that we understand what are the predisposing factors, how can we reduce the risk, what can be done to both prevent these cancers and to diagnose them early if they were going to develop. With ovarian cancer, there are certain things that increase the risk. We now know that genetics plays a very important part, and not just BRCA mutations like we've known for a long time, but now we know there's a lot more mutations that predispose women to these cancers. So knowing your family history is incredibly important. And I'm not just talking about ovarian cancer in terms of family history. I'm talking about family history of breast cancer, family history of melanomas, pancreatic cancer, prostate cancer in males. It is very important that we all know where we come from and what kind of diseases run in the family. And once we know that, it is very important to get a genetic evaluation and to find out if any of these genetic mutations run in the family. So genetic predisposition is certainly a very important factor to know about, but there's others. We know that ovarian cancers happen later in life. After age 60 is the most common time. We know that these cancers are somewhat more common in women who have not had children. We know that these cancers are more common in women that suffer from endometriosis. Endometriosis is a relatively common benign disease that a lot of women suffer from. Women who have endometriosis frequently have struggles with conceiving and having children, and that by itself is a risk factor for ovarian cancer. But additionally, women with endometriosis can develop special kind of ovarian cancers called clear cell cancers or endometrioid ovarian cancers. Protective things for ovarian cancer is just the opposite. So women who have had a lot of children, anybody who has had 5 children during their life, decreases their risk of ovarian cancer by 50%. Women who breastfed their children similarly have a decreased risk. One of the most important risk reduction things that we can do for ovarian cancer to decrease the risk is birth control pills. Any woman who takes birth control pills for 5 years decreases her risk by 50%. Anybody who takes birth control pills for 10 years decreases their risk by 80%, and so forth. So unless there's any contraindication, that is one thing that women can do for themselves to decrease the risk, is to use birth control pills, because that significantly decreases that risk. Women who had menopause late and menarche came early have a somewhat increased risk of ovarian cancer, and so forth. So all these factors are very important for us to be able to assess the risks that a specific woman has for developing this cancer. And the reason why that's important is because women who are at significantly high risk would have a different way that we would watch them versus somebody who is at low risk. So I mentioned previously that unfortunately ovarian cancers are diagnosed at late stage. The reason for that is that unfortunately we are just not good in finding these cancers early. There's many reasons for that. The most important one is that for the longest time we used to call ovarian cancer the cancer that whispers. We used to say that ovarian cancers really have no predisposing symptoms, and that's why nothing can be done to diagnose these cancers early, that these cancers will always be diagnosed late because there's just no way to catch them at stage 1 or stage 2. But we now know that that's not the case. We know that ovarian cancers are not whispering. It's really that nobody is listening. Many studies have been done, some very big and good studies have been done that showed that even though, of course, a great majority of women with stage 3 and 4 cancer had symptoms, as high as 89% of women with stage 1 and stage 2 cancer had symptoms as well. These symptoms were some bloating, some gastrointestinal symptoms, some urinary symptoms, feeling like the clothes didn't fit very well. The trouble, of course, with symptoms like that is that those symptoms are very common. And a lot of women have these symptoms. And of course, in those women, these symptoms do not mean cancer, but rather they are hormonal. What separates the symptoms that are normal and part of hormonal changes, especially changes of menopause, from those that later were diagnosed as cancer, is that the women who subsequently developed cancer or subsequently were diagnosed with cancer had these symptoms every single day for at least 2 weeks. And usually it wasn't just one symptom. Usually it was a combination of abdominal discomfort and gastrointestinal symptoms and urinary symptoms. So it wasn't just one, it was a combination of symptoms. And it didn't come and go like hormonal symptoms frequently do. This, on contrary, appeared every single day. And that is the way to distinguish whether the symptoms that all of us experience and are very normal, which are hormonal, from those that are different for you and out of the ordinary for you, and should be brought up to the attention of the provider. If a woman feels any of these symptoms, it is very important that she brings these symptoms to the attention of a provider. Very frequently, when women do experiencing these symptoms, they don't necessarily associate them with ovarian problems or gynecologic problems, And very frequently, they actually bring these symptoms to the attention of other physicians, like primary care physicians, like a gastroenterologist, or a urologist, or a chiropractor, as some women actually present with back pain. So it is very important that when the woman brings her symptoms up to the provider, that they verbalize that these symptoms are new to her and they are persistent, and that she demands a workup for these symptoms. We do so much work, not just for awareness for women, but we are doing so much work for awareness for providers as well. Over the past year and a half, we have started a very important campaign and very important program called MET Foundation, where we are educating not just women about the importance of these symptoms, but also providers of different types to understand the importance of these symptoms in early diagnosis of ovarian cancer. It is very important that when a woman sees a physician and they rule out their part of her symptoms, that the woman still is aware that the symptoms is still not normal. And even though the workup might be normal, might be negative in that specific area, that she demands and then receives the care that she deserves. If we ever worry about ovarian cancer, then we recommend a visit with a gynecologist, and the gynecologist would do a physical examination and very frequently would order a transvaginal ultrasound. Transvaginal ultrasound is the test that you would do for these symptoms and for evaluation of the ovaries and fallopian tubes, if that was our concern. It is quite an easy test. I don't recommend a CAT scan or PET scan or an MRI. Transvaginal ultrasound is the best non-invasive test that we have. A lot of you probably have heard about a blood test called CA-125. And that test we do as well at the same time as a transvaginal ultrasound if we're worried about the symptoms. Like I mentioned in the beginning, unfortunately, all these tests are not perfect. But when a woman has symptoms and combined with a physical examination and a history of the family, these tests are very helpful and usually provide the diagnosis. As we discussed the benefits of transvaginal ultrasound and CA-125 or OVA1 or other blood tests for diagnosis of ovarian cancer and their importance in diagnosing ovarian cancer and diagnosing it hopefully early if the symptoms arise. This conversation is a bit different for using these tests for ovarian cancer prevention or early diagnosis if there are no symptoms. A lot of research has been done, a lot of literature has been published, and we know that unfortunately in women who have no symptoms, transvaginal ultrasounds and the blood tests, even though they're the best thing we have, are not the best. And that is why it's important that we don't recommend ultrasound and blood tests for all the women, because the concern is that if the woman is at low risk for developing ovarian cancer, and then we continue doing these ultrasounds and blood tests, then we potentially can have a very high chance of false positive results, and women will end up having surgery that was unnecessary. That is why it is so important to know who are the women actually at higher risk for ovarian cancer. Because if they are at high risk, then our predisposing concern is higher. And in those cases, we certainly recommend that we check ultrasounds and blood tests at least once a year. If a mass is diagnosed on ultrasound, we unfortunately cannot and should not be doing a biopsy. And that is very unique to ovarian cancer. As you know, if you have a mass, let's say in the breast, then we won't just be taking it out right away. We usually would biopsy it. That is not the case with ovarian cancer. With ovarian cancer, the concern is that if we were going to put a needle and try to biopsy the mass, we potentially would rupture it and we would break it. And if we broke it, that would be worse if this indeed was cancer. So usually if a mass is diagnosed, we look at it very carefully to decide, is it a concerning mass? Is it a benign looking mass? And many benign looking masses we just observe and just watch. It is really just for a mass that we do not feel that we can observe, that we really feel that we need to be able to look at it under the microscope to make sure that there's no cancer. Those masses we gotta take out. And in women who are young, we always try to take out just the mass and leave the part of the ovary that's normal. For women after menopause, depending on what the mass looks like, we usually remove the whole ovary, again, because there's a risk that we would rupture it otherwise. Whether we do additional imaging once the mass is found on ultrasound really depends on the specific circumstances. Sometimes we will do a CAT scan prior to removing the mass surgically, but most of the times we will do nothing. The definitive diagnosis of what a mass on the ovary could be is really just looking at it under the microscope. So we would surgically need to remove it. And most of the times I don't put my patients through additional tests when I feel that they will not change what we need to do in the first place. So yes, sometimes we would do a CAT scan before we proceed with surgery. Other times, most times, we do not. So much has changed in the field of ovarian cancer over the last decade. Even over the past couple of years, we have gone new treatments. We have gone different ways that we are looking at these cancers. We certainly do not treat these cancers the same. Just because the cancer is the same in different women, we do not give the same chemotherapy to everybody. Everything now, especially here at Yale, is now truly personalized. The surgeries that we used to do with big incisions in the belly where women would stay in the hospital for 10 days are no longer done like that. I do them now laparoscopically or robotically, and women have tiny little incisions instead of the big cut they used to have. And instead of staying in the hospital for 7 to 10 days, many women stay in the hospital one night or even go home same day and are able to return to work within a week or two. Every tumor that's removed is studied, and we studied for 380 mutations, and we truly understand what is driving that cancer. So we can offer this woman particular, specific, individualized, targeted therapy specifically for the cancer in her. We no longer treat the cancers the same. We really understand what the treatment should be in that particular woman, and that not only improves the efficacy and not only improves how well the chemotherapy works, but it also significantly decreases the side effects and allows the woman to be able to live her normal life. The treatment for ovarian cancer is a combination of surgery and chemotherapy. And as I just mentioned, chemotherapy nowadays is truly becoming individualized, targeted therapy specifically for that woman. So thank you again for having this conversation with me today. I am so pleased that we are able to discuss these symptoms and to increase awareness. Women are their best advocates. We need to be aware of our bodies. We need to know what is normal for us, what is not normal. We need to know our history. We need to know what our risks are, and then do everything we can to prevent cancer from happening. Ovarian cancer outlook is bright. The future is bright. Things are getting better. So much research is being done on treatment and surgery and maintenance. But we struggle with curing these cancers, and we struggle with early diagnosis, as I mentioned. So the best thing we can do for ourselves is prevention and listening to your body and knowing what is normal for you and what is not normal. And when you feel something that's not normal, you go and you demand the care that you deserve. That is the future. And we as providers are doing everything we can, not just to increase awareness for women, but to increase awareness for providers and for physicians, for nurse practitioners, for chiropractors, for psychologists, to know what these symptoms might look like. And most importantly, to listen, that when a woman is telling us that something is wrong and they do not feel the same, that women need to be listened to and their concerns need to be addressed.
Well, I thought that was great. I hope you did too. I hope that you learned a lot about ovarian cancer and can be more proactive about your own health or about the health of the women that are in your life and that you love. I hope that you will like, share, and subscribe to this channel. And be sure and leave us a comment. If there are other videos that you'd like to see, let me know. I'm here to help you in terms of providing evidence-based information for your health and wellness. Until next time, this is Dr. Anise Chagpar.